Hello friends, welcome to WowIS. This is the ninth part of the May 2023 current affairs. In this video, we are going to cover the ethics topic. In our initiative, we are providing you crisp summaries of the Vision Monthly magazines, which is less than 50 pages, and along with it, you will be provided video lectures. This is all available at a rate of only 599 rupees. It covers the whole year of 2024 till February 2024. Because after February 2024, you get the prelims, this prelims PT 365. So the rest part can be covered from there. Now, in this way, you can enroll in this course by subscribing to this QR code and send it as the payment detail, or you can use the link provided under the video. So let's start with today's topic. The topic is ethics. The first topic here is clinical trials. There has been a joint report by US India Chamber of Commerce and PwC India titled as Clinical Trial Opportunities in India. Now, India's clinical trial opportunities are increasing steadily due to several key regulatory reforms aimed at towards global harmonization, enabling open access to clinical trials in India. The country has diverse population and has a rapidly advancing healthcare infrastructure, which are providing a fertile ground, which are actually enabling clinical trials to flourish. Now, regulations of clinical trials in India. Drugs and Cosmetic Act of 1940 in India, regulations pertaining to clinical trials are placed in Schedule Y of this Act. New chemical entities cannot be administered to human subjects in a clinical trial without permission from the DGC, DCGI, yani Drug Controller General of India. The Drugs Control General of India (DGCI) is an official of the Central Drug Standard Control Organization (CDSCO), who is a final regulatory authority for the approval of clinical trials in country. Then ICMR ethical guidelines. It mandates setting up of ethics committee at the institutional level for the purpose of scrutinizing and approving clinical trials before it begins, and to conduct a periodic reviews of the progress of the trial. Then phases of clinical trials in India. Now, there are 4 phases in which the clinical trials are being done. First phase is human pharmacology. Non-therapeutic trials, and objective is to determine the safety of the new drug and determine the maximum tolerated dose, as also determine the nature of adverse reactions that can be expected. Second is phase 2, therapeutic exploratory trials. Control studies conducted in a limited number of patients of either sex to determine therapeutic effects, effective dose range, and further evaluation of safety and pharmacokinetics in the patient. Third one is phase 3, therapeutic confirmatory trials. It to obtain adequate data from the efficacy and safety of drug in a larger number of patients of either sex in multiple centers, usually in comparison with the standard drug and placebo if a standard drug does not exist for the disease under study. Phase 4, after approval of the drug for marketing, phase 4 studies or post-marketing surveillance is undertaken to obtain additional information about risk and benefits resulting from the long-term uses of the drugs. Then next is, what are the international rules and regulations regarding clinical trials? The first one is Belmont report. It gives 3 basic principles which are accepted on cultural tradition, are particularly relevant to the ethics of the research involving human subjects. The principles of respect of the person, benevolence, and justice. So these are the 3 principles: respect of the person, benevolence, and the justice. Second is Declaration of Helsinki. This agreement was put forward by the World Medical Association and has been amended many times to address the new ethical concerns. So this declaration is related with new ethical concerns. The Nuremberg Code, it was rectified following World War II in response to the abusive and exploitative clinical trials undertaken by Nazi scientists. It provides an international standard for clinical research ethics. Next is Good Clinical Practices (GCP). It is an international ethical and scientific quality standard for designing, conducting, recording, and reporting trials that involve participation of human subjects. Then International Ethical Guidelines for the Health-Related Research Involving Humans 2016. They are prepared by Council for International Organization for Medical Sciences (CIOMS) in collaboration with the World Health Organization. About clinical trials. They can be defined as a set of practice that helps certify a new drug molecule as safe and efficacious before reaching the market. Clinical trials play a critical role in healthcare delivery. The process of conducting clinical trials is characterized not only by scientific rigor but also by strong commitment to the ethical standards. For instance, in the COVID 19 crisis, clinical researchers understood the sense of urgency surrounding the need for treatment and vaccines. However, they were compelled to follow the ethical protocols to ensure that their data was accurate and transparent. Next is various ethical principles involved in clinical trials as per stakeholders. So, if we talk about as per the stakeholders, the first one is the clinical trial patients. The informed consent is very necessary. They have a right to receive comprehensive information about the research, ensuring they fully comprehend it and voluntarily participate. Second is beneficence. They are entitled to ethical treatment that respects their decision and protects them from harm while also promoting their well-being. Then compensation for research related harm. Patients who suffer harm from participation are entitled to fair compensation after proper assessment. Then privacy and confidentiality. Patients have the right to control their personal information. This information should be safeguarded by the research team. Then what about sponsors? First of all, avoiding conflict of interest. The sponsor should have robust policies and procedures in place to identify and mitigate the potential conflict of interest. Because what the sponsors have, they are actually investing in that clinical trial. So if any clinical trial is going against as per the expected results, then the sponsors might be having a conflict of interest. Either they should be ethical in their perspective or they should focus upon their economical terms. So they should have a well placed policies and procedures in case of any conflict of interest, so that the human factor is avoided from there. Next is post research access and benefit sharing. Sponsors should ensure that benefits from research are accessible to relevant individuals, communities, and populations. Then distributive justice. Sponsors should strive for equitable distribution of research benefits and burdens among the participants. Then research. Principle of essentiality. Researchers should not only involve human participants when it is essential for the proposed research, considering all alternatives and existing knowledge. Privacy and confidentiality. Researchers should safeguard the confidentiality of the participant and community data. Environment protection is also important. They are responsible for protecting the environment and resources at all stages of the research. Then what about regulatory agencies? They should focus on benefit risk assessment. The regulatory agencies should ensure that social and scientific values of research justifies the potential risk. Transparency and accountability. They should ensure research plans and outcomes are accessible to the public while respecting participant privacy. Healthcare providers. Beneficence. Healthcare providers should ensure patients participating in trials are treated ethically with their well-being a top priority. Informed consent. They should provide support. They should support the process of informed consent, helping patients understand the research and their voluntary participation. Then society. Post research access and benefit sharing should be there. Then there should be focus on distributive justice, that is selection of just research participants should aim for an equitable distribution of research benefits and burdens. Then there should be transparency and accountability. Wider society should have access to research plans and outcomes, contributing to the broader understanding and awareness. The next is clinical trials. There can be side effects. So minor pain, discomfort, injury from the invasive processes, or potential harm from the drug side effects. Then there is lack of transparency. That is the issue, one of the issue there, because they bypass the regulatory framework to expedite the trials for increased profit. Then vulnerable population is mainly targeted. There is lack of informed consent and the compensation. The participants often fail to receive the compensation when clinical trials do not succeed. So that is one more issue here. The next is stem cell research. Despite the proven therapeutic value of the human stem cells, ethical concerns remain around their harvesting, particularly from human embryos. Then drug trials in neonates. Ethical challenges include the inherent vulnerability of this population, their higher risk of mortality and morbidity, and the difficulties in obtaining informed parental consent. The next is way forward. What should be done? First of all, regulatory approval. The approval process is slow due to new requirements for the submission, review of the clinical trials, which needs to be streamlined. So we need to streamline the regulatory approval. Second is patient recruitment. It depends upon availability of investigator sites and patient willingness. Increasing the number of investigator sites could help in getting more patients. Next is ensuring quality and compliance. Institutional Ethics Committee ECs should devote time and effort to understanding the ethical issues like human protection, independent decision making, handling conflicts of interest, reviewing safety reports and compensation, and overseeing clinical trial conduct. Next is development of national clinical trial infrastructure to conduct clinical trials independently and collaboratively. So there is a national clinical trial infrastructure is required for that. Next is regulatory approval. Clear and unambiguous regulatory approval applicable to diverse situations would enhance the efficacy of trial approvals. Next one is education in ethical clinical trials and compensation for trial related death or injury. So this completes your clinical trials. Next topic is child artist and ethics. The National Commission on Protection of Child Rights has issued guidelines for child and adolescent participation in entertainment industry or any commercial entertainment activity. Now, why these guidelines are required? Because there is an increase in the child participation. With the boom of technology and social media, children are increasingly participating in the content creation. Then there are chances of child exploitation also, because they are being exploited for their innocence, for lack of adequate regulatory regulations protecting them, and their right for the multiple stakeholders. Then the work environment. In order to ensure a healthy work environment for them with minimal physical and psychological stress, these guidelines are required. Then there can be stressful exposure, and most important is the crime against the children. For example, they are susceptible to the plethora of crimes such as sexual exploitation, child trafficking, bonded labor, etc., working in unregulated ecosystem. So that's why we need these regulatory guidelines. Now, what is the regulatory framework? There are two things. First is Child Labor Prohibition and Regulation Amendment Rules of 2017 and Juvenile Justice Care and Protection of Child JJ Act of 2015, which provides a legal framework for child artists. The key provisions are, first of all, the scope. The key provisions of the guidelines that have been released. First of the scope. The scope is that all television programs, including reality shows, TV serials, news, informative media, movies, OTT platforms, content on social media platforms, performing arts, advertising, etc., or any other commercial activities included in these guidelines. Second is there should be registration of child artist with the district magistrate. The producer has to ensure that he has the consent of the parents or guardians and the name of the individual responsible for safety and security of the child to the DM. Third is inspection of the workplace. The DM have been empowered to instruct the district child protection unit to inspect the workplace accordingly to issue a permit to the producer. Next is content restrictions. No child or adolescent should be cast or made to participate in a role or situation or content that is inappropriate for a child or may distress him, which exposes a child to a situation causing unnecessary mental or physical suffering, that involves the indecent or obscene representation of a child, nudity or exploitation act, or which is not advisable, not certified to be viewed by them. Then the presence of a parent or guardian is necessary if the child is below the age of 6 years. Working hours should not be more than 5 hours a day. The wages, at least 20% of the income, should be directly deposited in the fixed deposit account. That activity should not affect the child education, and minimum number of working days and instruction hours in an academic year should be maintained. Next is children in news and media. The media and production houses shall ensure that child victims of sexual offences, trafficking, drug substance abuse, organized crimes, and child used in armed conflicts, child in conflict with the law, and child witnesses, etc., are automatically guaranteed anonymity for life. Next is stakeholders' perspective and ethical concerns. First of all, child. What are the ethical concerns with respect to the child? First of all, one's choice in kinds of situation which child faces. There is a lack of those choices. Then the conflict with education and cognitive development. It can be detrimental to physical and psychological health due to different kinds of exposure. Then there is the issue of privacy also due to public visibility. Then the regular sessions of the child with the social workers and counselors to understand their choices and problems. And compulsory attendance criteria in schools with minimum exceptions. Then with respect to parents and guardians, the attraction of fame and fortune creates enormous pressure on child and their parents. They also face difficulties in reinforcing a child's sense of self and coming to terms with the reality of the profession in which the appearance matters the most. Then sensitization of parents and children on the difficulties and realities of the industry. Then production houses and industry agents showcases child actors as models for ideal lifestyle or stardom, which many would want to emulate. Then extension of work shifts to more than statutory limits, low wages to child actors, various unscrupulous agents cash in hopes of parents and children, then enforcement of statutory working hours and heavy fines and penalties on illegitimate agenting practices and frauds. With respect to viewers, representation of false idols and maturity that child finds difficult to emulate and come under extreme stress. The negative impact from inappropriate display of child's character. Film rating system needs to incorporate different kinds of portrayals and accordingly certify the film for appropriate audience. Then inappropriate display of a child's character should not be a part of any production. And statutory warning on such situations which might influence viewers in a negative manner. Next is government. There's lobbying by industry groups to relax the regulations. Then there is difficulty in striking a balance between child's right, education, parental aspirations, industry's demands, viewers' discretion. Then government organizations such as National Human Rights Commission can be involved in attack policy making. Then regulation and law should factor in the best interest of the children involved in terms of his or her education, cognitive development, and values incorporation. Then last is conclusion. Ensuring ethical conduct in employment of children in the entertainment industry is of paramount importance. The stakeholders like industry, parents, child right organizations, government should collaborate to develop and adhere to the comprehensive code of ethics for the employment of the children. So with this we cover the ethics part also. In the next session we are going to come up with the schemes in news and the rest part of this magazine.